Pia Ingorani getting us all those latest details right there. Dr. Pratit Samdani, consulting internist and critical care physician of Breach Candy Hospital, is now joining us live as well. Dr. Samdani is somebody who's been at the forefront as far as coronavirus is concerned, has shown some stellar recovery in a lot of his patients as well. One of the leading doctors in Mumbai, Dr. Samdani. Appreciate you taking the time out and joining us on this broadcast. Amitabh Bachchan is 77. When you have patients who have crossed a certain age group, who are in the 70s age group, what is the first concern that you have with patients like that?
Thank you, Charity, for this opportunity. And I firstly wish the Bachchans a speedy recovery. So someone who's in the septuagenarian or the 70s age group is obviously at a high risk. We now have our own data and our own experience across the globe to say that the elderly, specifically people above 65 years of age, have a higher incidence of morbidity and mortality. In fact, if you see the data, almost 30 to 40% of people above the age of 80, 85 needed admission, specifically if they had some comorbidities. I'm not aware of the comorbidities that Mr. Bachchan has, but if one does have underlying comorbidities like cardiac issues, a chronic liver disease, a neuromuscular disease like myasthenia, these diseases put a particular patient to a higher risk. And we have to be a little careful. It's also important that, typically what I've seen in my last 4 months, the patients between day 10 and 17 is the time when they go into the cytokine storm. A cytokine storm is a devastating complication of this COVID-19, in which there is inflammatory cells that batter all the organs, virtually all the organs, specifically the lungs. If one has an underlying condition that involves the lung muscles or the lung tissue, you need to be more careful. Also, if you need to use specific drugs, you have to be watchful and cautiously, judiciously use them, because if they go into the cytokine storm, specific drugs like interleukin-6 inhibitors, like tocilizumab, is commonly used by us. Now, this also has a draw side on it. It can cause or precipitate infections. It can activate in viral infections in the body. So you have to be careful if you have an underlying liver disease. So this does put Mr. Bachchan at a higher risk compared to Abhishek, who's much younger than him.
And ever since the start of coronavirus, you've been at the forefront treating COVID-19 patients. I'm aware of that. Whenever you have patients who are coming in, who have crossed the 50s age group or the 60, what you call quote unquote vulnerable age group as well. The recovery rate, if I could ask you to put a percentage on the kind of recovery rate that you've seen in patients like that, because that perhaps, is something that will give a ray of hope to many viewers as well watching our broadcast, not just for Senior Bachchan, but just at large.
Oh, yes, Chetty. So let me tell you, the mortality in this viral infection is not high. It's not high. Whether you're in the 30s or you're in the 70s and 80s, the relative total mortality is not high. My personal experience that most patients, when I use the word most, it goes to above 95% of the patients do extremely well. The elderly may take a longer time to recover. They require more chest rehabilitation, specifically because they have a lot of comorbidities, but most of them do return back to normalcy in due course of time. The ill effects or the long-term effects of the lung injury will only have to waited and observed. We don't have answers to that because it's just a new baby, 4 months old.
Right. And why do you see the cases of coronavirus in Mumbai rising so fast? Mumbai, pretty much not been able to come under control and has been the hotspot since day one when the outbreak broke out in India as well. You did see the cases just rising and rising in a steadfast fashion in Mumbai. What is going wrong with Mumbai at this point of time?
See, demographically, geographically, Mumbai is certainly the epicenter, and I would quote unquote, like any other big city in the world, whether it's New York, it's Milan, or it's Mumbai, financially capable cities or financially very strong cities have a dense population. Mumbai, unfortunately, has a very, very high density of population. The congestion, the number of people living in a home or living in a house, the bathrooms, they are very, at places there are 10 to 20 people using one single toilet, and that's a dangerous situation. So I think the first thing is density of population. People have started to learn to behave themselves in terms of physical distancing. I would call it physical and not social distancing, wear masks. But unfortunately, I do see some people now in the last 10 days who have started not evading, but have become more casual to their approach in terms of keeping, the norms to prevent COVID infection. So I think this behavioral attitude of people or citizens across the country should be kept right at the forefront, and we should be careful and watchful and not fearful.
Oh, absolutely. Thank you so much, Dr. Pratit Samdani, for joining us with those valuable insights right there. So the masks really needs to be your second skin. The coronavirus has spared no one, including senior Bachchan and junior Bachchan as well. I thank you very much, Dr. Pratit Samdani, for taking the time out. We've got some breaking news coming in. We'll have to cut straight across to it.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.